What mood disorder or suicide prevention resources do you recommend to your patients? And what resources do your patients report back to you that are most helpful?
Well, some general common sense measures are very helpful. Like I tell my patients, I say, look, if you live in a house with someone who is struggling with like an alcohol addiction, you do not want to have a big stash of liquor around because, in a moment of desperation, that person, it's just going to make it more likely. The same way, I mean, if you live in a house where folks are struggling with thoughts of suicide, general measures like like firearms that are easily accessible, poisons, big stash of like lethal medications. I mean, those just common sense things where if you ought to have them, those gotta be locked in a in a situation where in a moment of desperation someone is not gonna use those to. Obviously, that's just part of the story. People can still find other means, if that's something that is persistent and going through their minds. The other part is being really attuned to early signs of decompensation, early signs of depression, where often you can just tweak treatment a little bit rather than someone descending into a full-blown episode of depression that's going to take months away from their lives and sometimes even require hospitalization, right? But it access to good providers, responsive providers, that if someone is not doing well, where they can get the help quickly, pretty soon. I also have the hope this potential hasn't materialized yet, but technology in the form of real-time monitoring has the potential, to just help communicate in a more responsive fashion with loved ones, family members, and treatment providers as well. So I really have the hope that using some of these newer tools, we will figure out ways to just pick up early signs that someone is decompensating, that the thoughts of suicide might be coming back, and bring them for help, for treatment sooner, as a way to prevent more tragic outcomes there.